Good afternoon, everyone. It's my pleasure to introduce Dr. Aline Gragossian, the presenter of this year's Peter Safar Honorary Award Lecture. Dr. Gragossian completed a residency in emergency medicine at Drexel University, followed by a fellowship in critical care medicine at the Mount Sinai Hospital in New York City. In 2019, while in training, she received an urgent heart transplant after being diagnosed with familial cardiomyopathy. Since then, she has embraced her unique perspective as both a patient and a doctor, leveraging her voice to passionately advocate for the importance of organ donation, transplantation, and living with chronic illness. Dr. Gragossian is currently an intensivist through Equum Medical and an associate medical director for the Donor Network West. She's also the chair of the Transplant Community Advisory Council under the American Society of Transplantation. Please join me in welcoming Dr. Aline Gragossian as she presents New Heart, New Life.
Hi, everyone. I'm so thankful to be here. I can't believe that people still want to hear my story, but here we are. I'm Aline Gragossian. I'm an intensivist through Equum Medical, and I'm here to kind of tell you guys what happened to me over the last couple of years towards the end of my residency training. I have no relevant disclosures pertaining to this lecture specifically. I am a physician at Equum. I'm an executive at Donor Network West as their associate medical director. I'm a consultant for both Paragonics and Abbott Cardiovascular. As an overview, we'll go through my story, some not on your board's critical care pearls for all of you, and then kind of I'm not going to be too cheesy, but you guys are the ones that decided to come to this lecture. But I do want to talk a little bit about how I found the silver lining in everything that happened to me. Starting with the story. So I'll take you guys back about 5 years and 2 months to November of 2018. At that time, I had been an emergency medicine resident applying to critical care fellowships. As you guys probably know, usually fellowships interviews are done between August through September, October, and then the match is November, December, if I'm not mistaken. And everything had been going really well in my life. I was 30 years old. I was in my final year of emergency medicine residency at Drexel. This was in Philadelphia. Academically doing really well. I was excited to go on to do fellowship. One of my top programs was the Mount Sinai Hospital in New York City, and that's where I ended up matching. So that second picture is me, November of 2018, celebrating how I matched into this amazing critical care fellowship at one of the best hospitals in the nation. And then the only thing that I sometimes forget about what was going on at that time. I thought I was doing really well, but I did have this persistent cough. It started around, I want to say, end of October, beginning of November of that year. I think I got sick, or maybe I had some sort of congestion. I was really chalking it up to nothing. I mean, as you guys know, during residency, some of us we work through anything. There's all these stories about how people were working with IV bags and things like that. I remember there were a couple of my co-residents who had the flu, so I was like, maybe it's that, maybe it's something else. I don't know. I didn't think it was that big of a deal. The point of that being that even as I was going through this illness, it wasn't really keeping me from doing anything. So one of the common questions I get asked is, didn't you have any other symptoms? Couldn't you have diagnosed yourself with something? And no, I mean, I was still going to work okay. I was celebrating me getting into fellowship. In fact, there's a picture of me just like the Saturday before everything happened. And I felt fine. I was still working out, probably not as much as before, but I think that's because I was on night shifts. There really was nothing that I could complain about. Towards the middle to the end of December, there was this one shift that I had. I was an ER resident, but I was working as the ICU resident at one of our community hospitals during residency. I went to work that day. This was the week before Christmas, and my ICU attending, she's probably watching this, or she's going to watch this at some point, but it was Dr. Freed. She noticed that something was off, and I remember her specifically telling me something like, you're stopping in between sentences to take a deep breath. Something is off with you. You're not really, there's something off. And, we're ICU doctors, we can tell these things. And she even said, she's like, if you don't feel better, get a chest x-ray. She said all these things, and I was like, yeah, I'm fine. I'll just finish up my 24-hour shift like a good resident, and then I'll figure it out after. That night, I actually also we used to run to the codes at that particular hospital, and I would always take the stairs because it was a way for me to get exercise on these 24-hour shifts because I wasn't going to be at home. And I remember that particular night, there was a code on the floor, and I had to stop in the stairwell before I got up to the second or third floor, and that was really weird for me, and I was like short of breath, and something's off. Finished the shift, I ended up going home, so keep in mind, I started the shift the day before, I probably went home the next day around 7 or 8 a.m., and then I felt really sick. When I say, I couldn't walk just a few feet to get to my own bathroom in my apartment without just, stopping to take a deep breath. Something was definitely off. Following day, I kind of slept throughout the day as much as I could, and that night was when I was like, all right, something is off. I gotta go to the hospital. I happened to be dating someone at that time who came to visit me, and he was surprising me because it was right before Christmas weekend, and he was worried about me. He had told me, something looks off about you, let's go to the hospital. I ended up going to the ER that night, and I want to say, I think I had shortness of breath, I had a cough, I was tachycardic, they did a chest x-ray, it looked like I had, possibly a multifocal pneumonia, but it was still really hard to tell. I'm overall a healthy 30-year-old. We don't really know what's going on, but you're going to need to get admitted for a further workup. And while I was hospitalized, everything got worse. The last thing I remember from this particular hospitalization was feeling really, really cold and sweaty. And I remember getting really nauseous and looking up at my own monitor and noticing that my heart rate, which had been in the 120s up until this all happened, was now 30, 29, 28, and I was like, something's off. And that's the last thing I remember from that night. I had to get resuscitated. I ended up getting intubated. I was on pressors. I ended up in the ICU. I think they were still doing a full workup. I don't remember much of this process, obviously, but I was taken to the cath lab. They did a bunch of things, and eventually I wake up in the ICU a couple days later, and I am still intubated, and there's a bunch of people around me, my own colleagues, my own attendings, my own, the nurses that I had been working with, my co-residents, and everybody seemed really worried. And they were like, yeah, your EF is 5%, and you are very sick, and do you know what's going on? What can this possibly be? So I eventually got transferred to Penn, which is the place that I ended up getting my heart transplant. So when I got to Penn, they told me, because of the pathology, I ended up finding out it was familial dilated cardiomyopathy was the official diagnosis, but it looked like it had been subacute, and I had really dilated ventricles, and so they couldn't do much. Basically, the only thing that they could have done for me at that point was an urgent heart transplant. I got diagnosed, listed, and transplanted, and discharged all less than about 3.5 weeks of my life. So it was this completely new diagnosis. I even remember not totally understanding if I was a person with chronic illness or a disability because it happened so quickly. I was like, well, now I have a new heart, I'm fine. The recovery itself was very interesting. I think keeping in mind that up until all of these different things that happened to me, I had been healthy overall. So I think the recovery wasn't too bad, but of course I did have some issues. I ended up having this acute rejection episode, so I had to get a midline placed, and I had to get some steroids at home, which is that first picture. I started learning what it was like to take 20 pills a day, 4 times a day. It was pretty crazy, and I finally understood what it meant when patients, either forgot medications or had difficulty with their medications. I had to learn all about the different side effects. All the scars that I had on my body were this new normal for me that I had to be okay with. And of course, physical fitness, which was big deal for me. I remember, when you get a heart transplant or any kind of open heart surgery, you have a sternotomy and you can't really lift anything for the first 8 weeks. There's all these different things that you can and can't do, but I was really determined to go back to my life. And I think the hardest thing for me, which I'll go into this a little bit later too, but I tell patients, anytime you have this critical illness, if you have some sort of ICU stay, it's going to be hard for you to go back to who you were right before all of that happened to you. And that's okay. And you can maybe get to 90%, even 99%, but it's going to be a completely new world for you, and that's okay. That's kind of what life is. You have to be okay with these things that happen to you, and it's kind of up to you to figure out what you want to do with the rest of your life. So I think up until then, I was like, all right, I am going to do everything that I was doing. I'm going to do it even better. And then at one point, I was like, you know what? Maybe I can't, and that's okay. I did my best to get back to who I was, but obviously I'm a completely changed person with a new heart now. Just to bring it back to ICU, since this is SCCM, I did have some issues with not only my ICU stay, but of course the whole transplant itself. I was very weak. I was the ICU patient that was walking around the unit 2 or 3 times a day, pre-transplant and post-transplant, with all the drips hanging and everything. But even with that was nothing compared to what I had been doing up until my stay. So I had a lot of weakness, muscle aches. I remember I didn't even understand, I got discharged, I think, on a Wednesday, and by the Friday, I was back in the ER with, I'm an ER doctor, so this is one of my least favorite chief complaints, was just full body pain. I couldn't explain it. I was like, I am just hurting everywhere, and I can't explain this. And it was just, my muscles were very weak. I had a lot of insomnia. Till this day, I have insomnia, but I remember it was really difficult for me to just the trauma that I had been through as an ICU patient, constantly being checked on at nights, constantly being, and that's fine. I was very sick, but these things do stay with you. I started having this thing when I was hospitalized, was like, well, if I fall asleep, then I might die in my sleep, so I'd rather just stay awake until morning. And so I think that still travels with me till this day. The pain, of course, as I talked about, from the muscle weakness was a big issue. And then later on, I actually ended up developing AVN in my hips. So I had to get both hips replaced about a year after, during my ICU fellowship, which is a whole other story on its own, because of the steroids that I had gotten. Not only as, with transplant, you take a bunch the first 6 to 9 months, but also I had gotten stress dose and I got these high dose steroids when I had my rejection episode. This isn't to say that we shouldn't do what we do. This is just to point out that there are some consequences of the things that we do to our patients. With post-transplant highlights, I love talking about this. I completed my emergency medicine residency. I only had a few months left, so I went back and I finished that. And then, of course, I graduated from a 2-year fellowship in critical care at the Mount Sinai Hospital. That's actually a picture of me on my last day of fellowship in the cardiac ICU. So in the CT ICU, not the one that I was in as a patient, but I was there taking care of heart transplant patients. So it meant a lot to me at that time. And, I'll say some jokes here and there. One of the first things I did, I don't know if anybody from Mount Sinai is here, but one of the first things I did when I was extubated, right when all this is going on, was I emailed my program director, future program director, and I said something like, hey, I was emergently intubated, and now I'm extubated, and I have this cardiogenic shock thing going on. I just want to make sure I could still do fellowship if I make it to June. That was my main, and the thinking that I had was, well, I got to know now because I have to open up a new ERAS application if they don't say that they can take me. And these are the kinds of things that, were going through my head, which says a lot. I ended up meeting the family who helped save my life. This is Laura and Mark Reff. There's a lot that goes into how an organ donor family meets a recipient, but long story short, I ended up meeting them, and it's been great. They're like my second family. And it was one of the best things that happened to me, because I feel like because of what happened to their daughter, who I'll get to, her legacy was able to, continue as somebody who was in the healthcare field. She was actually an RT student. She had always wanted to work in an ICU. Super crazy, I know, but she had wanted to work in healthcare to help save people. And I try to make it a point to remind people and her parents that, she did. She saved 4 people through organ donation, me, 2 kidney recipients, a liver transplant recipient. But even more than that, she saved everybody's lives who we've touched as recipients, not only the actual people that I take care of as a doctor today, but even my own family and all these other people that are very well connected to me and the other recipients. So it meant a lot. She ended up, and her mom is very okay with me saying all this, and she wants me to say it, but she did have a ventricular cyst rupture, and totally out of nowhere. She had been studying for her exams, and she had a headache, went to the ER, and basically brain dead within 12 hours. So her family was already involved with organ donation and transplantation. I think, if I'm not mistaken, they had a family friend or someone who had been a transplant recipient. So, and she had been wanting to be an organ donor, and so they immediately transferred her to this other hospital, and she became an organ donor, and then saved my life. So it was pretty amazing. Clinical pearls is stuff that I get asked about often as an ICU doctor who happens to be an ICU survivor and transplant recipient. These are things that I've learned as a recipient that I think has been important for my practice. I'll get to the first 2 first, and then I'll go to the first one. I should have put that in this different order. So communication is key in healthcare settings. I think as ICU doctors, and again, I'm trained in emergency medicine, both ER and ICU, we are kind of there to coordinate a lot of care, but sometimes patients don't totally know what we do. I specifically remember my family who, they're immigrants. Mom doesn't really speak English. Dad speaks a little bit. They're not doctors. They just didn't understand why the ICU doctor would come in and tell me that everything was fine. And then the heart failure cardiologist would come in and say, oh, no, you still need a heart transplant. And they thought that, they were like, well, the ICU doctor is much more positive. And I was like, well, though, I think the point of the ICU doctor is to make sure that I stay alive and stable. And, the point of the cardiologist is to figure out what exactly is going on and when I should get a transplant, if any. There's different things that we all do in healthcare. And I think it's important to explain this to patients. All it takes is a simple explanation. I am so-and-so, I'm in charge of so-and-so. We're gonna work with the team to figure out this and this. Things are dynamic in the ICU, which is very important to constantly tell our patients, as we know. But it was so important for them. They just didn't understand why the ICU doctor wasn't talking about my transplant and kept saying I was fine. And, it's not anybody's fault. I just think it's the way the system does it, and we just need to be better about communicating that with our patients. Of course, empathy helps. I'm not here to tell you guys that, go through a cardiac arrest, you'll be a much better doctor. I don't wish this upon anybody, not even my worst enemy, if I have any. But I do think that something that happened to me, I use my voice to talk about it often for a reason. And I think it's okay to ask me, hey, how did that feel? Hey, what did it feel like getting a central line for the 8th time when you have a clot there? Things like that, just putting yourself in the patient's shoes and utilizing the resources that you have, even if it's people like me, to understand what your patients are going through is very important. The last thing I'll talk about, or there's a couple more, but this is the last one on this page. The power of your voice is very important. When you talk about your story, you empower others to do the same. When I first got my transplant, I'm 35 now. I was 30 at the time. I'm a millennial. Of course, I'm going to put everything on social media, right? There wasn't. When I got my transplant, the first thing I thought of was I got to go tell Instagram. Now, I didn't do it on purpose. It's just kind of the way that it is in my culture. And it turned out to be great because when I was very open about it, of course, there were some people who messaged me saying, like, are you sure you want to say that? You're a doctor. I'm like, oh, so doctors like can't have health issues? Like, that's not true. So I think for me, speaking up, and even more so when I realized that not many doctors speak up about these things, I found my own community. Docs with Disabilities campaign, not my campaign, but is an initiative done by Stanford and University of Michigan, and they talk a lot about physicians with disabilities and all the different things that they advocate for, and I'm a big fan of them. Now, I was getting messages. I mean, until this day, I get messages and emails from people who message me and say, I don't remember if it was a nurse or a doctor, but she said something like, I had chemo all throughout the last couple of years, and I never told anybody that I had cancer in the hospital. And that's not okay. We shouldn't stigmatize just because we're in healthcare if we have health issues and disabilities. And so I made it a point to constantly talk about it. We actually created a group. I call it the Docs with Transplants group. So initially it was just me and a couple of other physicians who have solid organ transplants, and now after 5 years we're at almost 70 people in that group, and that's people from all over the world, and it's so nice to have that. And again, I'm not saying they need to be open about it. Not everybody is comfortable being open, but I want them to know that there is this safe place that they can go to where we can talk about things. Another thing that I had done, a lot of women with transplants, especially around my age, generally speaking, after a heart transplant, they do recommend not getting pregnant. And so it is very common reason that I saw that women would say that they'd rather not get a heart transplant because they want to get pregnant, or they had all these different issues. So it was nice to be in a group with other women with transplants. I called it the Zipper Club because of our sternotomy. And it was just nice to have that place to talk to each other. So it was amazing being able to connect with others, and it was especially important for my professional colleagues to do the same. Appropriate support matters. This is a major thing for our patients. I know in the ICU it's probably not as, it's probably getting there just because we do a lot of ICU survivorship stuff, but it meant so much to me to have a group filled with people with heart transplants who were similar to me. I think the hospital that I was at initially gave me like a support group, and I mean, again, I'm not discriminating against it, but like I went to this group and it was all just like old men with heart transplants. Like, what am I, the main thing, I was like, what am I supposed to say? Like, are you guys on Tinder, right? Like I had nothing to tell these people. I had nothing in common with them. And, I wanted to go back to work, right? Like, I had all these different, like, things that I wanted to do. And it doesn't mean that that group shouldn't exist. It just wasn't for me. And so it's important to talk to your patients that there are different groups out there. Not every experience is one size fits all, and we constantly say that. The paper that I have up there, I just wanted nothing more than to get in a real shower, patient experience of the inpatient wait for a heart transplant. Kobe Salerno, who is my colleague, he's a cardiologist with a heart transplant. We have a podcast together. He wrote this, and it, I think, came out earlier this year, and it's all about patient experiences in the ICU while they're waiting for organs, particularly hearts. He's also a heart transplant recipient. And, it was just the little things that mattered. Having someone to talk to. He actually came up, one of the conclusions that he came up with in that paper was it would be really nice to have patients talk to other patients when they're hospitalized for things like this, if possible. It doesn't mean that it has to be like the person next door, but if there's an ambassador that could come to the hospital to talk to the ICU patients who are going through similar things, it kind of does help. When I was ICU fellow, I made it a point, at least once a week, I would go and, talk to either the pediatric patients, generally the younger patients who were waiting for transplants, and I honestly felt like that was so much more powerful than what I did as a physician, which is so interesting when I say it out loud. I even remember one patient telling me that that was more life-saving than any intervention that I did. It was just telling him, like, you know what, like, I'm your age, I have a transplant, and I'm okay. It doesn't mean it's easy. I'm just saying that my life is okay after everything I went through, and I'm here if you want to ever vent about something. It was really, really powerful to hear that from multiple patients, that, it was really nice to have you say that. And the silver lining, a word on advocacy for the future. So when I was first hospitalized, got my transplant, I was post-op day 7, which should still be the blog post that's up. I started a blog called A Change of Heart. At that time, I was like, oh my God, I probably got like an amazing heart that's giving me all this energy. I think it was just the steroids. like were giving me like a lot of, like I was manic. Like I was like typing things on like post-op day 3. So I started a blog. And again, it started initially just as a way for me to share my story instead of constantly telling everybody that I was okay, like texting them. I was like, I'm just gonna post everything on my blog. And then I was like, I could just use this website. Maybe I paid like $10 a month to like have that domain name or something. I'm just gonna use this website to talk about organ donation, talk about transplantation, talk about women with heart failure, talk about young people with critical illness. And then I was like, maybe I can also put in some resources. I could do fundraisers on this. So it started off as me just telling my story, and it blew up into a million other things. And I remember one of the nurses, the ICU nurses, coming in to like help out with something, and I said, I want to do something with my life. She was like, you're literally an ER doctor. Like, it's not like you're already doing something pretty important. I was like, no. I just feel like, everything that's happened to me, there has to be something good that comes out of it. Again, I'm not a cheesy person. I'm not like super positive. Like, I'm not one of those people, but I do think it's important to have others understand that it was kind of a way for me to justify what I went through, right? Like, I'm able to advocate for these things. I have this platform as a physician, and it makes me almost feel like it's okay that I went through what I went through because I'm doing something with it. And that was a lot for someone like me who really looks for fulfillment in my life. So I started the blog. I, again, didn't think it would get big. It got somewhat big. It's no Amazon, but it's big, ish. I also started this podcast with Colby Salerno, who I talked about earlier. He, at the time of my heart transplant, he was already 5 years out of having a heart transplant. He's my age. He was in internal medicine residency at the time, and he messaged me on Twitter, and he was like, hey, I see you have a heart transplant. I'm also a resident with a heart transplant. And I was like, oh my God, like, I really needed to meet you. So, we're like, he's like my brother now. We're like best friends. But he and I always had this idea of, why don't we start a podcast called something, we'll talk about different things pertaining to organ donation, transplantation, medicine, healthcare, anything. Honestly, we're just like amateur podcasters. It's probably not even good. We just like doing it. But we started this because of the connection that we made earlier, and we both feel like it's been important. I mean, I think in the last 2 years that it's been out, we've already had 10,000 downloads. Which is pretty insane for 2 people with mics who don't it's really nothing crazy, but it's fun, and it's a way for us to tell our stories and bring other people in to tell their stories. And it's just been this thing that I've been able to do with what happened to me. I also wrote this paper. I think this was also the steroids making me like really manic and having too much energy. But I remember like month 2 when I was really bored because I wasn't able to go back to work for a few months because I was hyperimmunosuppressed. I was like, anytime a cardiac transplant patient comes into the ER as an ER resident, the best thing about having a transplant patient as a patient is the dispo is just to admit. Like, there's nothing else that you have to do. You just press the admit button and they can get admitted. But because we just didn't have enough education in emergency medicine about what to do with heart transplant patients. So I talked to Alex Koifman, Britt Long, and we decided to write this paper together, a primer for managing cardiac transplant patients in the ED setting. So, I mean, till this day, my friends in ER will send me this, oh my God, I had a transplant patient today, and so I thought it was pretty cool. I'm not trying to be one of those attendings who puts their own papers up. This is just to show the cool things that I did because of something really adverse that happened to me. We ended up getting this published in American Journal of Emergency Medicine, I think a couple years ago, 2021. But it was something that I had worked on as I was recovering, so it was very cool. And that's all I have for you guys. Do you guys have any questions for me at all?